And I have a disclaimer in that I do not have any financial interest in the products I'm going to talk about or the companies. I'm just going to share with you the people and the things that, or some of them, I couldn't put them all in, the things that I have really enjoyed working with in my practice. And then I will make this other claim in that I need help. So if somebody wants to move to right above Atlanta in God's country, it's beautiful there. If you like boating, fishing, golf, hiking, any of that. So I need some help. I'm a little nostalgic. I got into this group late in my dental life, but next year is the 40th anniversary. And so some of the founding members are here with us still. And I have this group, I didn't realize there was a group like this with the Holistic Dental Association until I got sick. And I'll show you who introduced me, but I have met some great folks. I never knew Murray Vimy or Mike Ziff, and I meant to pick up a book of Mike's we use at the office about amalgam, and we give them to the patients, and if they're interested in sharing it with somebody else, then they give it to somebody else. If not, they bring it back and we share it with somebody else. And I didn't know that Phil Sukil had curly hair in the middle there, because when I knew him, it's more like mine, not so much. One of the first people I met was Ron Dressler, and Ron was in Atlanta and reached out to me and just took me into the group. There weren't this many women. I met Janet early on, and Ron is a founding member, Dave Reggiani, and Phil Sukil are all founding members. I've got David Kennedy on this page because I thought he was, but I think he came a year later. So, and just great people. A little tribute to Matt Young. We lost Matt a few years ago, and he signed his president's letters Matt Y, so we started calling him Matty. And then super, super sweet, nice guy, Rich Fisher is a founding member, and he's been the Scientific Advisory Board. This is where he's getting the President's Award from Matt that year. Some other folks that have been around a long time, Terry Messerman, Marcia Bassiano, and Jack Call. Jack's been the chairman of the board for a long time. And Marcia and Janet, who's here, practice together. And Pierre LaRose. I heard him in the question and answer session years ago. Y'all come, because the question and answers are really good. And somebody was asking about a prevention protocol for decay, and Pierre said, I've used supersaturated clear potassium iodide and iodine for years for decay prevention. So bingo, I'd never heard it in any lecture. I just heard it in the question and answer session. So stay for that. Matt and Demir, I'm going to say his name wrong probably, from Slovakia. We used to have chapters. Now we're all just one group. And this was Steve Coral, one of the folks who reached out to me right from the very beginning. I just always felt like I was at home with this group. And so the second year I started coming, we started playing golf. And Phil Sukil, David Reggiani, and Ron Edwards, and Ron and Steve just said, hey, come go to dinner. A bunch of us are going. And I just fell in love with this group. And I love this group. And I found this group because I got sick. And I didn't realize, I was so busy working, head down all the time, I didn't realize how toxic dentistry was until I met Ricardo Boyer at a Chamber of Commerce meeting. And he saw me grimace when I stood up, my foot hurt, and he said, what is it? I said, plantar fasciitis, and he said, no, that's your liver, it's toxic. I was like, yeah, whatever, right. Well, 3 days later, I was in his office, and that was my introduction to EAV testing. So energetic testing and things like that were totally new to me. But I've always been one to want to learn more, and since I got into this whole arena of holistic dentistry and biologic dentistry late in my career, I just kind of jumped in with both feet, and I still don't feel like I know much. The more I know, the less I feel like I know. But let food be thy medicine has been a wise thing that has been around for so long but we sometimes ignore it. And if you don't have health, really, what power do you have to take control of anything if you don't have health? I think many of us, especially, I know Janet and I both got into this group because we were looking how to get healthy. We were so toxic. And what you think you know hinders you from learning other things. Sometimes you're just not open-minded enough. And I was taught in dental school the mercury's fine. Once you mix it with the powdered metal, it's inert, it's fine. And so for a long time, I didn't realize how toxic dentistry is. So I have begun to look at a lot of different things besides just teeth with my patients. We talk about things like, I really like dealing with the kids. I used to do big silver braces and that kind of thing. I've kind of honed my practice down to the things that I enjoy the most or the things I feel that are most important. And so I look at faces a lot now, not just teeth. And in conventional dentistry, I'd heard of Weston A. Price, but it was kind of a derogatory attitude because of his research with root canals. And in conventional dentistry, I did a lot of CE, but it was all about doing stuff. It was all about how can I perform more? How can I do more procedures? And when you look at nutrition and how it affects the health, even on the left, even people that are not kin to one another, because they have good genetic potential in a gene pool, they all look very similar. And even in one generation of poor diet and toxicity introduced, even just from processed food, then you can see the change in their mouths. And what he decided was they ate a lot more water-soluble vitamins, more calcium and minerals, and a lot more fat-soluble vitamins, even than the diet in the early 20th century, where a lot of people were farming and eating out of the garden and that kind of thing. And then every culture he studied, they all prepared for childbirth. They prepared young couples when they were about to be married so that they would produce healthy babies. So a lot of the foods that were the most nutritious were saved for that time period when they were about to start having babies. Unlike our diet today, and I grew up on when TV dinners and Tang and McDonald's and all these restaurants were starting, so definitely our nutrition today is very, the standard American diet is that, SAD, SAD. So Weston A. Price and Francis Pottinger have created the Price-Pottinger Foundation, but Pottinger found out that after 4 generations of bad nutrition, cats were infertile. So if you look at our society today, that's obvious that we have hit that point. I have a lot of respect for Royal Lee. He was a dentist in the early 1940s, and he figured out what autoimmune disease was. He didn't call it that, but he figured out a process to help nourish our glands so that you can nourish your glands back to health without having to actually take the hormone. You can take a thyroid protomorphogen, which is a cell extract that I think nobody still knows how he did it except that company today. But it nourishes your glands, but you don't have to actually take the hormone. So Dr. Price talked about the recycling of nutrients, just like Nathan Bryan in the nitric oxide talks about the recycling. We need nitrates and nitrites for nitric oxide. Probably not the bologna and hot dogs I grew up on. That's all I ate, they say, for a long time. But we need to recycle and get good nutrients. And that's why the food-based supplements are so good in that they are grown many times in a very healthy soil environment, unlike the no-till farming they do these days that's full of Roundup. So one of the things that I stumbled onto early on in my career was digital radiography, and it has really been a boon. The people in this room, probably most all of you, are using digital, but it's so much less radiation and so much easier to use. I started in '96 with it, and we started In my practice, we started the business part on the computer in 91, which is when I started my practice. I've been in solo practice since 91 in Gainesville, Georgia. And in 98, I went to electronic charts, medical charts. I went paperless for a while, didn't like it. So early on, a friend showed me to just use paper, and then it has original ink. You scan it, and then I can look in a digital copy, but I still like paper. I'm really old-fashioned. And you young people are so computer literate, you'd rather do the computer than write. One of the things that I've learned a long time ago, this is an old slide, but just be sure everybody in your office is using the x-ray head right up close to the face, just because of the scatter radiation. Be sure and use aprons. I gave a talk with the Academy of General Dentistry years ago, and followed one of the professors from one of the schools who said, "Oh, don't use those anymore." Well, yes, the American Thyroid Association says that at the time I made this slide that thyroid cancer was the fastest growing cancer and directly related to dental x-rays, because they can extrapolate from people, say in Africa, who've only had a few dental x-rays in their life. They can extrapolate that the incidence of thyroid cancer in those people. A lot of the pediatric offices are doing bite wings every 6 months. I just think that's too much. So this is the collimator I have. They don't make this one anymore. Henry Schein has got one you can get. But for rectangular collimation, if you notice, the green circle is the x-ray head far from the face. That's the amount of radiation coverage. And then the red circle is at the face. And then the blue rectangle is actually the size of the sensor. So you just want to expose the sensor and no more. I won't spend a long time talking about fluoride, because y'all have probably just been to the fundamentals course yesterday, and I heard we had a really good turnout with like 100 people, so that's wonderful. The thing I will mention is, as we go through this, is kind of my experience, and my girls are 25 and 27 now, and all that time ago, I didn't realize fluoride water was so bad. And one of my girls was off the chart for height at like 3 months old, and in the 8th percentile for weight. So the doctors convinced me to put her on what I now know is soy formula, GMO soy formula, mixed with city water. Even though we lived in the country, it was city water. And that dose of fluoride that she got was 300 times the adult allowable dose at 1 part per million then, and they lowered it. Since then, they've lowered it to 0.7. But just know that, and I have seen water in the stores, in Walmart particularly, that said baby nursery water with added fluoride. So please, 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 just spread the word. David Kennedy is a gem, if y'all haven't met him. He, I think, is the fluoride expert in the whole world. And so I just was putting this together, and there's a link under here if y'all listen to a podcast. And David explained my personality completely. He said, if the mama gets fluoride, the baby's got ADD, ADHD. If the baby gets fluoride, they're lethargic. Well, I'm always hyper and wait until the last minute to do anything. So I just finally understand my personality. I put this slide in just because I live in North Georgia, and they say arsenic is naturally in the water table, that we have a high level of arsenic. Well, it's really not. It's just from the poultry industry. They use arsenic as the insecticide in the chicken feed, and we don't really need insecticides in chicken feed, because if the bugs get in the chicken feed, it makes the chickens healthier, supposedly, if they were grown naturally. And Congress, in their infinite wisdom, has declared chickens herbivores, which if any of you have ever seen chickens, the bugs and worms that's what they prefer, and that makes their eggs really rich. So the toxins that we are using have just become global. That's why I put this slide in, because when you look at the fluoride, because the chickens are fed fluoridated water, if you look at that accumulating in their bones plus the arsenic, there's just toxin after toxin after toxin. That child that I put on formula mixed with city water, did not get any teeth until she was 16 months old, and her first cousin didn't get any teeth till she was 13 months old. So delayed tooth eruption is one of the things that we talk about with fluoride toxicity, and that flat affect that so prevalent in the society today is just kind of an apathetic personality, and that comes in large part from fluoride toxicity. And if you note in this chart that bone cancer happens particularly in young boys, and it's pathognomonic for osteosarcoma is pathognomonic for fluoride toxicity. Dr. Tennant tells us that fluoride will replace iodine on the thyroid hormone, and it makes a fake thyroid. If y'all haven't met Dr. Tennant, he's very good, and I suggest you listen to him. It gets a fake thyroid hormone called a reverse T3, and T3 is the active form, but that one doesn't work. So we all have basically, I think, a ubiquitous hypothyroidism in this country. And one of the things that you can look at in your patients, and it's funny the things that come up in conversation in a dental office, but I have started using, as part of my decay protocol, I have people brush with a liquid clear iodine, and I have people make comments like, it has helped so much with things I didn't think about, and I've got a slide in here somewhere that I've had people say it makes them sleep better, everything from sleeping better to increased libido, but everything in your body that secretes a mucus or a liquid has to have iodine to have that iodine symporter. And I know David Brownstein's here too, so you've got a good dose of education there. So I have a friend, Tom Lockensgaard, who has been a holistic dentist in Nashville and is associated with the Truth About Cancer group. And so Tom and I are kind of like minds. And what are our patients looking for? Really, they're looking for the same things we're looking for. We're looking for the hope that we can get detoxified and stay detoxified, which just gets harder and harder in our society. You know, a holistic team approach, to have a functional medicine doctor who understands, which is why this group is so good, to have physicians, dentists, and scientists all working together. That's what we need to help ourselves be healthy and our patients. And then to be heard and understood and have our opinions be respected. So many people say, well, they wanted to just force that fluoride on me, or they wanted to force these x-rays on me. So many people just want to be heard, and they want their opinions validated, which I feel like we do too. And a little bit about Tom. He's working on a biologic dentistry program and naturopath program. They'll all be online. Hopefully they'll be out this year. And just a plug for my friend, Dale Bigtree is going to publish his book, Matters of the Mouth, which it talks about functional medicine integrating with biologic dentistry. He's got some products. I don't make any money off of them. I just like them and I use them, and I brought them all with me. But the first one is the toothpaste that he has some really good cinnamon bark, some really good things, but humic and fulvic minerals, like when you hear Jerry Tennant talk about the energy in our body, we need that mineral composition, those electrolytes in our body to make the electricity work in us. And then also, if you haven't heard the dental transport, the dental fluid flow in the teeth, natural teeth sprinkle out. They sprinkle out acid to help heal the damaged cells, and then they sprinkle out minerals to heal. So arrested decay is a tooth that has healed itself. So when that dental tubule flow, when that hydraulic pressure goes the right way, then teeth don't have to worry about taking in anything from the outside environment in the mouth. And so the carbamyl phosphate in this toothpaste helps reverse that, get it going healthy again. So it does help reverse the tooth decay. Siladin is a form of silicone-making collagen in your body, and this actually does help remineralize bones, and teeth are just specialized bone, and it does help with muscle strength, and promotes good skin. So I need all the help I can get the older I get. So it's the easiest supplement that I've used. It's just 7 to 10 drops of water in water. It's the easiest one I've used for building collagen. And then OxyMist is hydrochloric acid, which is a redox molecule, and it's the gold standard for how antibacterial something is will it kill TB, and this will. They also have it in a less toxic type disinfectant you can use in the office. I spray it up my nose, I spray it in my eyes, I spray it on my face. It's good for healing and hydration. Also, you can nebulize it. When COVID came out, this is one of the things, food-grade hydrogen peroxide and this OxyMist as far as nebulizing it to help kill any invading organism in the body. Another way I use it is I've used this oral ID for a screening. It's not really a cancer screen, but just a tissue screen. And so I put people on a protocol to help prevent things that I've seen in the past in the mouth. And one is frankincense, rinse, swish, and gargle, swallow. And so I have decided to just prevent the things that I usually have found in the mouth later on, that I would send people home to use the frankincense. And now that I have the OxyMist, I also have them use the OxyMist because it doesn't harm the bacteria on the back of the tongue that create nitric oxide, and yet it will kill any other pathogens. And you've got the slides, so if you're interested in those products, you can get in touch with them. So Dr. Tennant, I think, has helped me understand the powerhouse of the body more than anybody else. And he says on blunt dissection, the fascia in the body, the fascial planes, are the same as meridians. And so the power in the body, the electricity in the body, we are electrical beings, and just like rechargeable batteries. And I use kinesiology, as Dr. Tennant does, to give me a yes-no answer. If a root canal tooth is harmful, or if there was a cavitation or a wisdom tooth extraction infection that in many times will be on the meridian to the hip. And so kinesiology is, I've taken lots of courses, but I just have a very simple, I just want to ask the body some yes-no questions, and it's an electrical reaction, so it's a real true answer. I use homeopathy. I've got the list here that we've used them pre-op for relaxation, post-op for pain. And homeopathy, basically, if you get a bee sting, then the bee venom will reverse the bee sting. So like cures like, kind of like a snake bite, you use snake venom to treat the bite. And just a brief, if you don't know about homeopathy, an herb, they make a tea, and then they dilute it, succuss it to get the energy in it. And when you get to Avogadro's number of water molecules, there's no more of the herb in there. So it's just a frequency. So we work on electrical frequencies, electrical impulses and frequencies. If you put two pianos in the same room, then you play middle C on one, the middle C string on the other one is going to resonate, and it's going to vibrate though no one touched it. So resonance, we have magnetic fields and resonance. And this is the one in the middle is the penicillin, which is it's a homeopathic, so people that are allergic can take it, and yet it will still do the same work. And I'm not getting anywhere near all these slides done. So essential oils play a big part. I'll talk about this slide a little bit. I first learned from a dentist, and I talked to Karen just a minute ago, wherever she is, went to the University of Louisville. My dentist did too. As a hygienist, I worked for him. So I sit directly at 12 o'clock behind the patient. I learned quickly, early on, I turn all the lights out except the light on the mouth and the light on the bracket tray. And actually, when I look at this slide, I realize I'm doing this extraction left-handed because I can see my ring on there. So I'm right-handed, but sitting at the back of the patient, I can sit up straight and have good ergonomics. And so I could actually do injections both hands and some extraction technique both hands. I never prepped anything with my left hand, but that ergonomics is that's my suggestion. If you're young in dentistry, my dentist said, learn to use your mirror, really use your mirror, and learn to sit at 12 o'clock. So those have been good things for me. And the oils, I have long used an aloe-based arnica homeopathic gel to massage people's muscles if they get tired while they're working, just to help keep them from having sore muscles and lactic acid buildup from being open. And then when I was doing surgery, I would talk the dental assistant into massaging me too. So let's see. So this slide, to have good nutrition, you got to have voltage. Every cell in the body needs vitamin D3. Every cell in the body needs iodine. You cannot be allergic to iodine. You can have an allergic reaction to something like shellfish that has a protein, but you cannot be allergic to iodine. And every tissue that secretes something has to have iodine to get that liquid out. So cysts, I used to have 9 kinds of cysts. So cysts are all an iodine deficiency, definition of iodine deficiency. So between iodine, ozone, and the Buteyko breathing method, I got rid of 32 class 4 breast cysts on thermogram class 4. So it can be reversed. So I can't say enough about essential oils. Also ozone, which is misspelled, I see. Ozone creates terpenes also. The skin's the largest organ. 80% of what you put on your skin is going to be absorbed, and 60% is in your bloodstream. And if you put essential oils on your big toe, in a nanosecond, it's in your brain. So essential oils are really super for doing lots of good things. Then they're plant extracts, so they're great. Dr. Axe has a thyroid protocol. There's so many people that are hypothyroid, and that's probably 9 out of 10 of the people that I feel are thyroid. It's puffy. So the brain, the breast, and the thyroid need the most iodine, and they swell when they need more iodine. My other daughter went from you men might not know what this means, but a 36 double D at 13 years old. When she started on iodine, she got a much more natural shape. But for hypothyroid, 2 sublingual drops of frankincense, and with a carrier oil, 1 drop of lemongrass and 1 drop of clove on the thyroid. And it's I think ubiquitous hypothyroidism in our country. There's oils that help everything. That slide was in the wrong place. Here's Steve Corll. He did some research for IAOMT about conventional versus holistic type root canals. And then I have kind of taken and learned that the teeth are not like in a jar with a top on them. The teeth are like a honeycomb, and things go in and out of the teeth. And that's why David Warwick told me early on, he said, if teeth are sensitive, have them brush with vitamin D, which is one reason I added that to my protocol, because it just gets rid of sensitive teeth, from what I've seen. And then I got the question a lot, do I take my mercury fillings out? I've got a cancer diagnosis. But what I have done and have practiced under is take the root canal tooth out, but don't change the mercury fillings while the cancer diagnosis is going on. Another IAOMT past president and friend, Stuart Nunley, did a research project with 3 dentists, chose 100 x-rays of root canals that they all looked, everything was okay, no pathology noted, and they took those teeth out, and yet there were 800 different species of bad bacteria around those, or microbes. These teeth, if you'll notice, have they've got amalgam built up. So that's what I was taught to do in school, 5 millimeters down the root, amalgam under the metal. So then you've got a electropositive, electronegative metal creating static electricity in the body. These are 4 teeth I actually took out. I don't do surgery anymore, but actually took those out. Dr. Shanklin talked just a few years ago about the NECOs, neuralgia-inducing cavitational osteonecrosis. And the most memorable case that I did was a physician actually who'd had root canals, extractions, bone grafts, implants too, up here, They failed. He had the implants taken out, bone grafts, and they failed. So when he came to my office, his naturopath from Atlanta came with him. And so it was just mush. So I basically curetted him out, and then the naturopath did a little test to tell me when we'd had it all out, and he healed up fine. So here's that tooth chart. This one is one that I like to use. They're different, and I've had, depending on what chart you use, I've had 2 women in my practice who had cancer multiple times, and number 19 was the tooth, which is not really on the breast meridian on some of these charts, but I've had 2 women in my practice who had breast cancer on that side, and the fill-in was not even a root canal. It was just a tooth that they both said, it's just bothered me. Ever since I had it done when I was a teenager, it's just that tooth has bothered me a little bit. So a low-grade chronic infection can wreak havoc on the immune system, particularly as we get older. If my patients get to be about 50 years old, I really talk to them about thinking about getting that root canal tooth out, because as you get older, your immune system wanes anyway. And if the immune system is always distracted trying to deal with that root canal. Now, we use ozone. I try to get people to treat them with an ozone injection, at least usually 2 or 3 times a year. I have muscle tested a lady who had a root canal on a front tooth for 20 years. I just muscle tested her last week, and it tested okay. It tested she didn't need any ozone. So some people's immune system are more toxic or more robust than others. So we talked about the electrical grid in the body and the autonomic nervous system. We know that every toxin, whether it's chemical, physical, or emotional, causes us to hyperventilate. Hyperventilation causes the inability to buffer pH. This is Steve Evans, and who works a lot with Dr. Tennant, and Steve's a dentist here in Texas. And so I worked with Steve through the Holistic Dental Association and learned the platelet-rich plasma and then the platelet-rich fibrin. And one thing that I did, I haven't had a drug license for prescription drugs in almost 10 years. Now, I haven't done surgery in about 3, but for a large part of that, I first used pain medicine when I first got out of school, and then I started doing the Tylenol Advil thing, and I thought, that's not really good either. So with good tissue technique, if you don't heat it up and you don't get it dry, and use homeopathics and essential oils, and frankincense in a pill is Boswellia, I really didn't have much post-op pain. I always saw my patients 48 hours post-op, because that skin ought to turn to gum in 2 days. If it doesn't, you're going to look for something like a dry socket. You're going to look for not healing. And then probably in my practice, this has probably been the thing that, besides ozone, I guess, has probably made the biggest difference in my patients and what they have enjoyed. If you've never driven an old something with a manual transmission and no power brakes and no power steering, then you probably don't realize how nice the new cars are to drive. But if you've ever had an old metal partial or seen one, some of y'all have never even seen one, that has a occlusal rest and in the middle, and then, or even a Flexite type flexible partial, the Thermaflex or whatever, if patients who've worn the old kind love this. Now, I always do a wax try-in if it's somebody's first time getting a partial, because they just don't know, they just don't know what it's like. They've never had one. So I always do a wax try-in, let them see them see it and feel it before we finish it. And then I have found that the people who've never had one before are much more accepting of a partial. Now, you can do single teeth. We never used to do that with the metal, but these clasps are clear and flexible, and they go in 90% of the undercut. So it's a very stable type partial. Some of you women may know, some of you may not, the difference in support hose and regular pantyhose. That's kind of how I describe it, because these are a snug fit. That's a semi-rigid frame, so the framework will actually flex a little bit into an undercut. And so it can be thinner and smaller, and it's the least toxic, least invasive replacement of a tooth. I'll tell you a quick story about a lady who actually we used ozone on her. She had breast implants. They had gotten moldy. She was really sick. They'd been in 20 years or so. She had them taken out. She got some better. She had a root canal tooth that tested bad, and I didn't take it out, but I sent her to a surgeon who uses ozone, and she got really healthy. And I tell that surgeon, don't talk to my patients about implants. They're sick or they wouldn't be coming to you. And sure enough, they put in, after she got healthy, they put in even a ceramic implant. And John Thomas, some of you may know, is epigenetic wizard, and he practiced in Georgia until just a little while ago. But I sent her to John, and he said that the placement and the surgical manipulation of placing the implant activated the mercury, probably in the mitochondria, in the bone, and she got sick again. And so in my practice and the patients that I've seen, if they've got a huge autoimmune issue, I don't recommend. And I did the training for implants, bought all the equipment, and I just don't. For me, I've been so toxic in my life that I just that little partial is so good. That's my first choice. Now it's their mouth. If they want to do it, that's okay. And now we get to the mercury part. Tom Duplinsky did a study and said that we dentists use more cardiovascular, more respiratory, more neuropsychologic, and more neurologic drugs than any other group of people, where it's a toxic environment. So when Ron helped me when I first got started, we didn't have SMART then, but I did go ahead and get accredited. These are some old pictures. This little nose that she's wearing, there's another picture in here. It's an old nitrous hood that had the hose go off their head so it wasn't in the way, like some of the old nitrous hoods. I've been using this Capdol handheld mercury separator. I still have the one big one plumbed in, but this one has for vapor and particulate matter. It's got a one-way valve, so it actually captures, I have forgotten, a 95% of the mercury in that. Plus they have a recyclable system that you can recycle it. It goes to Europe or somewhere, and mercury gets recycled, but it's better than going in the water because dentistry puts more mercury in the potable water than any other industry. Even though the food industry loses 8 tons of mercury every year, they lose it in our food system, in our food, that's where it goes. But anyway, that helps to clean up the environment. And these are some pictures that Ron gave me. He first had bamboo put in his floor. Y'all don't, probably most of you don't remember having shag carpet in the offices. Some of us I see maybe do remember, but I was a dental assistant using the liquid mercury dispenser into the powdered metal, mixing it, putting it in a squeeze cloth, and squeezing out the extra mercury, sitting in a chair over shag carpet. So beware, this is what I looked like, and this is not me, but this is what I looked like in dental school. My face looked like this, the acne on this girl's face. So I had deep cystic acne at age 9 and fibrocystic breast pain, even though I had no breast buds at 9, because my mom took the first 5 milligram unopposed estrogen birth control pill in the late 50s, early 60s before I was born. So I was born estrogen toxic, and then Chris Shade says I went into the worst field of career I could, into the toxic. But I literally looked like that. This is a patient of Ron's who, once he took her mercury fillings out, she all cleared up. So my suggestion for mercury testing, Janet and I were talking about this before. When I tested with Chris Shade's test, I didn't show up to have any mercury, even though for 25 years I had sat directly behind the patient, directly over the patient's mouth, drilling out fillings, with no precautions. And yet mine didn't show up. So it was in my mitochondria, hidden. And because of that, I have fallen asleep standing up in the clinic. I have fallen asleep driving on the interstate. I have fallen asleep sitting on a tailgate of a truck, talking to people. And so when you have that mercury deep inside, it doesn't always show up on the testing. You have to be careful. Janet and I were talking about the chelation that we used to do. We have so many good detox methods now, and I, for one, will be detoxing all of my life. One of the things that I've added just recently is a microbiome stool test. They have a great red light, green light, yellow light kind of thing. The same way same idea I got from John Coyce years ago about risk assessment. So when my patients come in my office, they get a little red light, green light, yellow light. I color it on a paper. They get a written 5-point risk assessment, medical, decay, restorative, growth and development, perio, and one more. I'll think of it. But anyway, it's a really good place to start to know what kind of probiotics, prebiotics, all that postbiotics, to know what you need to do as far as boosting your immune system. We know 70 to 80% comes from the gut. This was that nitrous oxide nose cone that we used, and I used these brown rubber goods for 25 years in my practice, but sitting right over the patient. They're videos that have the nitrous oxide coming right out of those rubber goods that are supposed to have the exhaust and supposed to help keep you safe. And we know that nitric oxide's bad for pregnant people trying to get pregnant. Dental assistants have the worst fecundability, if I'm saying that right. They have the worst trouble getting pregnant of any group of professionals because of the toxicity in the dental office. So I took that stuff right out after I lost the second 2 pregnancies. And John Thomas says that anybody with an MTHFR should never use nitrous. And I had a girl in my class lost a child under nitrous, and I was the first woman around for 50 years, so all the scared people and all the moms brought their kids to me, so I worked on a lot of kids. And I have been sitting right over them, looking in their eyes, and they were doing okay, and then all of a sudden, they're passing out. So nitrous oxide has a better affinity to the hemoglobin than oxygen does, so that's the problem with getting the oxygen back in them. I never had any problem. I did one time have to call the ambulance for a man before I knew about this, but I just have gotten rid of that. What I really want to do is blog, and I have a lot more stuff to show y'all, but I didn't realize how long it would take me to get through it. I'm going to show you a couple of slides. One is wear. This is all about breathing. So my whole thing is you can't have a normal, healthy pH, and this is a sign of an airway problem. And so being as conservative as I have been, I now have 14 crowns, and I started out at 20 with 2 bondings on cuspids, which wound up into veneers, which wound up into more and more and more dentistry, and I've never had a cavity, so I am the most conservative person you'll ever find, but I just built these up with composite to give her back that tooth structure, and I did a little aesthetic contouring on the top. I didn't bond anything on the top, but her speech is much better. But this is an airway problem. Let's see, if I can just go, if I can find a couple of things. Okay, so this is this will show you the difference in nutrition. These 2 boys, young African men, I think they were cousins, but look at the difference in the almond-shaped face this way and the almond-shaped face this way when there's an airway problem. Toxicity. This is just shows the toxicity of our kids. The graph shows 1 out of 100 rats die with 1 toxin, and 1/20th of the second toxin added to the first toxin makes all 100 rats die. So our toxicity for our kids is so huge. We got type 1, type 1.5, type 2, type 3 diabetes now, and David Kennedy says 1 vaccine for a baby, 8-pound baby, is equal to 30 weight ratio, compared 30 vaccines for a 180-pound person. And just one more thought on this. Andrew Molden is not alive anymore, but he had a very eclectic education. He was a research scientist, and then he went to medical school and did early childhood development and atraumatic brain injury. And he says the overwhelming immune response to things like vaccines and then Tylenol given for the fever just creates, in the brain, it creates the blood congeals because of the overwhelming immune response. The brain doesn't have pressure receptors in the blood vessels, and so it just congeals, and that's the only way that a child that's verbal goes nonverbal. And then these little kids at the bottom have crooked smiles, and this one has a lazy eye right here. That's actually my little cousin, and those are strokes. And this little boy is about 10 now. He stayed in the hospital for a couple of weeks with high bilirubin, and he had a liver transplant at 9 months old. He got 5 injections within 5 minutes of life because his daddy was standing right there watching. So I'm totally against that kind of thing. I will finish now, Janet, and then maybe I'll just do a webinar because I really didn't get to all the stuff I wanted to talk about airway, because airway is the most important thing. And I'll just leave you with one thought, and that is carbon dioxide disassociates oxygen off the hemoglobin. So you could have a car with a gas tank full of gas, but if you don't have a fuel injector to get it into the motor to get it to run, it won't work. So carbon dioxide disassociates oxygen off the hemoglobin so it can go in the cell, and carbon dioxide makes the cell more permeable so the oxygen can go in. So that's the whole thing that I work with children is teach them to breathe right and swallow right. So thank you.
Thank you so much.